In this video, we're going to take a look at the possible outcomes that occur when we perform a hypothesis test and the type of errors that we might see when we perform one. In general, when performing any type of hypothesis test, we can put our outcomes in one of four possible categories. And I've organized it in a table here. Along the side, these row labels are the decision that we make when we run our test. And along the top is the truth. What's actually true in reality. So this is what we think is true, what we think should happen. This is what is actually true. If we think that we should not reject the null, meaning we think the null might still be true, and the null is in fact true, that is a correct outcome. Which, as a statistician, makes me happy. So if we fail to reject the null, and the null is true, that's what should happen. If we fail to reject the null, and the null is actually false, meaning we should have rejected it, that's what we call a type 2 error. So type 2 errors are when we fail to reject when we should. In the next row, this is when we reject the null. So our sample is extreme compared to the claim that we made about the population, and it's statistically unlikely we would get a sample from that claimed population. If we reject the null when the null is true, that's another error, and we call that type of error a type 1 error. If we reject the null and the null is false, meaning I should reject the null, that's another correct decision. So 2 out of our 4 outcomes are correct. I failed to reject the null, and the null is in fact true, meaning I shouldn't reject it. That's good. I reject the null when the null is false. I should. That's correct. As statisticians, I'm interested in the likelihood that I commit those errors. How likely is it that I make the incorrect decision? And so alpha, which is this Greek letter here, is the symbol we use to represent the probability of committing a type 1 error. This is also known as our significance level. And as a statistician, this is something we have direct control over. We make a decision about how big or small we want the likelihood that we're committing a type 1 error to be. And as we go into this process a little bit deeper throughout these video series, you'll see what that looks like in practice. Beta, which is this Greek symbol here, is the probability of committing a type 2 error, meaning I failed to reject when I should have. And again, the goal as statisticians is to minimize both of those. I don't really want to make either type of error. Depending on what scenario I'm looking at, the consequences of one type of error might be better or worse than the other type. And those are things as a statistician I would want to take into consideration. So one thing we do as statisticians when we're setting up our study before we perform a hypothesis test is we consider what those type 1 and type 2 errors would look like in context of our question or our problem. and then set up our study, our sample collection, to make sure we're minimizing the one that is more detrimental. There is one more quantity that's related to these, and it's called the power of the test. And the power of the test is a complement to the probability of committing a type 2 error. It's 1 minus beta. We want to minimize beta and maximize the power of the test. One way to do this, to minimize beta and maximize the power of the test, is increasing our sample size. Unlike the probability of committing a type 1 error, where we have control over it because we're determining the significance level we're using, this we have less direct control over, and calculating him is a little bit more difficult, but we do know that we can reduce him by increasing our sample size. So we're going to do an example where we look at a scenario and try to identify these errors. So our example says, suppose our null hypothesis is a patient is not sick. Identify the type 1 and type 2 errors for this scenario and identify which type of error has the greater consequence. So I'm going to jot down what our null is. Null is not sick, which presumably means the alternative is the patient is sick. And we know that type 1 errors, if I scroll back up, type 1 errors occur when I reject the null and I shouldn't. The null is true. So reject H naught incorrectly. So let's look at what that looks like. If I reject the null, I reject this statement, I'm siding with this statement. That means I identify the patient as sick even though they're not. Type 2 is the reverse. So type 2, we fail to reject incorrectly. I know how to spell, don't judge me. It's been a long day. So in this case, the null is actually false in reality, and I am failing to reject it, meaning I'm saying this is true when actually it's not, and this is the actuality. So here, I'm identifying the patient as not sick when they actually are. We're asked in the question, identify which type of error has the greater consequence. And that's a little complicated in that we don't know what kind of sick the patient is. Are we talking common cold? Are we talking something highly contagious? RSV, COVID, Ebola? Like, what are we talking about here? If we're talking about something that's not super serious, it may not matter if we identify them sick when they aren't, because we're probably not using strong meds to treat, so even if they're healthy, we wouldn't cause any damage. And if it's not something serious and it's not something contagious, identifying them as healthy when they're not probably isn't going to cause any harm to themselves or others either. They're just going to feel crappy for a couple of extra days. If it is something that is highly contagious, Identifying a patient as sick when they aren't puts the patient at risk. Identifying them as healthy when they are sick puts everybody else at risk, because then we send them back into the population and they infect everybody around them. So in cases where it is highly contagious and severe, this is more likely the greater consequence. I would more likely be concerned with this happening than this happening, and I'd want to make sure I have an adequate sample size to counteract this type of error. All right, if you have any questions about outcomes of a hypothesis test or the type 1 and type 2 errors, feel free to send me an email or drop by office hours. Otherwise, I'll see you in our next video.